Good evening. My name is Colin Owen, and this semester I've had the privilege of being the OFA team leader. Now, it's really been a pleasure being able to work with the interns on my team, the 4 interns that you'll hear from in a second, and really get to know them. Unfortunately for everyone here, you won't be able to get to know them to the extent that I was able to throughout the semester. So, in order to make up for lost time, I've decided to compile a list of superlatives that might help you get to know these interns a little bit better. So to start off, Keith. Keith is the most likely intern to rent a laptop from the Innovation Hub because he locked himself out of the office just minutes before a very crucial interview with the CTO of a technology firm. Keith is also the most likely intern to challenge you to a 5v5 soccer match on the IM fields. Next we have Nikhil. Nikhil is the most likely intern to miss a few meetings because he was sick, or as he put it, in the hospital. Thirdly, we have Mary. Mary is the most likely intern to follow you around at a coffee shop and write down your orders. So, if you were sitting at your local Starbucks and someone was writing down your orders, hiding behind her laptop, it was probably Mary. And then lastly, we have Chase. Chase is the most likely intern to give you a detailed pros and cons list of all of the huevos rancheros within a 100-mile radius of Norman, Oklahoma. So it has been a pleasure working with my team, and I couldn't be more proud of the recommendations they have come up with, and I'm very excited for you all to see the results of all of their hard work. So without further ado, I introduce the Oklahoma Funding Accelerator team.
OFA operates a little bit differently than the other I-CCEW teams. We still work with firms to develop innovative solutions to their business problems. However, each OFA team member is paired with their own individual client. My name is Keith Nutter. I'm a senior finance and economics major from Houston, Texas, and this semester my client is Embeditech.
My name is Nikhil Kim. I'm an economics and finance major. This semester I'm working with DREV.
My name is Mary Vu. I'm a junior this year studying supply chain and accounting from Tulsa, Oklahoma, and this semester I have the pleasure of working with Redbird Coffee Cart.
My name is Chase Bonar. I'm from Northlake, Texas. I'm a junior supply chain management major, and this semester I got to work with the Oklahoma City Boathouse Foundation.
Embeditech has developed a new software named Montage that simplifies the process of developing and selling software developers' projects. From a development standpoint, Montage provides package and dependency management. Packages are reusable pieces of software that can be downloaded from global repositories and implemented into developers' own projects, and dependencies are when one package relies on another to function correctly. From a selling standpoint, Montage creates the infrastructure necessary for a two-sided marketplace, where developers can upload their own packages and download other packages that fellow software developers have created. Embeditech is already commercializing Montage in tandem with Virtuoso, another software that they have created. However, they are looking for additional commercialization options for Montage specifically. This work phase, I've identified the low-code market as a potential commercialization channel. The low-code market consists of vendors who look to license their platforms to firms who are looking to develop business applications more quickly. As opposed to the traditional method of coding to develop business applications, low-code platforms allow firms to develop these applications in a more visual manner, taking advantage of drag-and-drop tools that are basically pre-assembled batches of code. Montage would create the marketplace to transfer and download these pre-assembled batches. This low-code market is expected to grow to a value of $15 billion by 2020 and has been growing rapidly at a rate of about 50% per year. As I mentioned previously, Montage is already being commercialized in tandem with Virtuoso, which happens to be a low-code platform, so it's already in a great position to support these types of vendors. Furthermore, research shows that as these low-code vendors continue to grow their user base, they look to add more extensive features, such as marketplaces. Montage should provide reputable low-code vendors with these marketplace infrastructures through strategic partnerships. Research indicates that although 86% of low-code vendors currently have some sort of forum or online community already in place, only about 50% of them have some sort of marketplace infrastructure. Furthermore, these low-code vendors that do have marketplace infrastructures generally do not develop them in-house, they outsource them to some marketplace infrastructure provider. Therefore, I've identified 3 ideal targets for Embeditech to pursue: ThinkWise, ServiceNow, and WaveMaker. Each three of these low-code vendors currently lack a marketplace and have been identified as high performers in the low-code industry by leading industry researchers. Each partnership that Embedded Tech acquires, they can expect to generate $192,000 of revenue per year. After benchmarking to other marketplace infrastructure providers, pricing is structured generally one of two ways: on a commission per transaction basis or on a fee per active user basis. Research suggests that initially, Embedded Tech should lean to a more fee per active user basis, as many low-code marketplaces currently support free applications as of right now. As these marketplaces continue to grow with their low-code hosts, paid packages should become more prevalent. It's also worth noting that these pricing structures are fairly negotiable and can be molded to best fit the needs of a certain customer. Next steps for Embedded Tech will be to initiate contact with low-code vendors, finalize the terms of their engagement of their partnership with these vendors, and to fully integrate Montage into the vendor's current existing infrastructure. Now I'll pass it off to Nikhil to discuss his project with DREV.
DREV is a nonprofit medical technology firm based in San Francisco. They utilize teams of engineers to develop and create medical technologies for underserved communities in India and East Africa. DREV plans on launching 10 additional projects by 2028. The nonprofit has asked for a strategic plan that reduces product development costs. In the past, DREV has partnered with I-CCEW's APD team. Due to this partnership's great success, DREV should continue seeking partnerships with university engineering programs. To do this, I've created a framework for how these partnerships will operate, as well as vetting a list of acceptable universities based on several key criteria, and I've also projected the benefits of this partnership, as well as the cost savings. I created a timeline by benchmarking against previously successful DREV partnerships, as well as from recommendations from professors at several universities. The timeline provides DREV with an optimal level of oversight through biweekly meetings and progress checks with students, and it also highlights what students will be engaged in over the course of the project. DREV will provide a student team with preliminary market research into a well-defined and scoped problem. Students will then work on early concept and market sizing, and then go through a series of prototype iterations based on both DREV and patient feedback before finally refining their prototype design. Over the course of an 18-week project, DREV can expect to commit 10 hours per project, whereas a student will spend an average of 300 hours, which is typical of a capstone program. I've talked to program directors and professors at these universities. DREV should prioritize partnerships in the Tier 1 category because these universities provide their students with 2 to 3 program advisors that oversee the students' work. They require less than $5,000 to partner, and they allow students to waive any intellectual property that may arise during the course of the project, meaning that DREV will be able to retain full intellectual property at the project's completion. If DREV were to utilize the partnership program, they would be able to save $2.2 million in early stage product development costs and be able to launch an additional 10 projects over the course of 7 years. Industry averages show that 86% of launch projects end up being successful and having impact. Based on DREV's past project performance and history, 8 successfully launched projects will reach nearly 200,000 poor patients around the world. For DREV to implement this plan, they should finalize a list of project ideas. They should then reach out to universities from my partnership list and then monitor project launches and impact through 2028. Next, I'm going to hand it off to Mary, where she'll talk to you about Redbird.
Thank you. Redbird is a coffee truck that currently serves the Oklahoma Central area. They will be moving into a brick and mortar location by the end of the year in the heart of Yukon. Jessica and Rachel are the owners, and they are currently social workers and hope to use their connections to benefit the teenagers in the Department of Human Services system and provide these teenagers with an opportunity to gain work experience. This semester, I have been tasked to help Redbird transition their business from a truck to brick and mortar location. So far, I've identified the potential customer base in Yukon, paired customer preferences with marketing strategies, and built a financial model for Redbird. The total available market for Redbird is $3 million. The coffee shop market in Yukon is comprised of 3 competitors. I have calculated this number by sitting in at each of these coffee shops and counted how many people came in and what they ordered. I then extrapolated Google data to figure out how much revenue each of these coffee shops would generate in a year. To be competitive, Redbird should capture at least 17% of this market. Square Up is a POS, or point of sale system, that Redbird has already implemented into their truck. A loyalty program and mobile ordering system has been advised that Redbird should implement because I conducted a survey with 125 respondents, and many of them stated that they go back to certain coffee shops because of the loyalty program and because of the convenience of mobile ordering. Square Up can offer these 2 low-cost, high-profit features to Redbird, and not only increase their profit, but also make sure that the customers feel appreciated by rewarding loyalty and providing convenience to these customers. Redbird can expect about $260,000 in profits per year. I calculated the revenues by using that same Google data and sitting in coffee shops in the first slide and multiplied it by the percentage of the 3% growth rate of the market. The variable costs were calculated through an industry standard, and the fixed costs are comprised of the employee wages, rent, and utility costs. The next steps for Redbird will include obtaining a loan amount from a bank, hiring employees, and any other preparation work before opening up their brick-and-mortar location at the end of the year. Next is Chase with OKC Respond.
This semester, I've had the privilege to work with the Oklahoma City Boathouse Foundation, more specifically their nonprofit program, OKC Respond, which provides first responders with services that range from physical fitness all the way to mental health and wellness. Now, this semester, I was tasked with developing a plan that would allow OKC Respond to become self-sufficient as well as grow their impact. I did this in 3 phases. First was identifying the key components needed for the program. Next was developing a business plan for this national model, and finally was an implementation plan for the program. Currently, OKC Respond provides its first responders in its local area with health and wellness services in order to combat common health issues in the first responder community. Currently, there are close to 700,000 overweight first responders. 547,000 will experience some type of form of PTSD or depression. And finally, there are close to 71,000 related injuries in the first responder community every year. And it's in every one of these areas that OKC Respond combats these issues by providing their services: high-performance physical fitness, mental health and wellness, and finally is physical therapy, which is a service that they do not currently provide. However, after interviewing first responders, I identified physical therapy as the most demanded service that be added to OKC Respond's program. Now, they currently provide all of these services at a local level for a total yearly cost of $160,000. So going forward, OKC Respond should implement a national health and wellness conference, which would allow them to become autonomous as well as become a premier health and wellness center. After talking with first responders and fellow health and wellness providers, I was able to identify the conference model as the best delivery method in order to solve OKC Respond's problems. It brings 3 big benefits for them. The first is access to new partnerships and sponsorships. Next is new grant opportunities. And finally, they get to expand their impact for first responders. So, when looking at the implementation of the program, OKC Respond can expect a total time span of 7 years, which can be broken down into 2 phases. The first is the pilot stage. Now currently, OKC Respond has a swift water rescue training conference, which provides floodwater training to its first responders. OKC Respond should begin to implement its current local health and wellness services into this program in order to grow the program as well as get a proof of concept for the conference. Next, they should implement their new health and wellness conference around year 3 after their current conference reaches its maximum capacity. So when looking at the conference, OKC Respond can expect to cover their local yearly costs of $160,000 in year 4 of just the national conference by itself. Now, what does OKC Respond need to do to get here? Well, they need to acquire around 48 exhibitor revenue sponsors. Next, they need to have an attendance level of around 950 participants. It's also very important to note that this program can be profitable in its first year, which would allow OKC Respond to begin the process of covering those yearly costs. So what does it look like for OKC Respond going forward? Well, they next need to begin to implement their health and wellness services into their current conference. Next, they need to pursue partnerships and new sponsorships in order to help fund this new conference. And then finally is when they reach the maximum capacity and have a good idea of what the conference needs to be, and from the feedback of their first responders, they should implement their program. On behalf of the OFA team, I want to thank you for your time tonight and listening to our presentations and hearing about our projects. We've had a great semester, so now we'll open up to the floor to questions. Anybody?
My question is for OKC Respond. How did you land on physical therapy being the most important? I mean, yes, physical therapy is obviously a very important thing that first responders need to deal with. But what about the 547,000 first responders that deal with PTSD?
Right, so your question is, why am I recommending the physical therapy aspect that they be added? When looking at those other two numbers, the overweight number and the PTSD, they already currently provide services in those two areas. The injury came about from interviews with first responders and them identifying common pain points that they have in their job and some of the injuries that they have. They commonly referred to back problems, knee injuries, and they identified physical therapy in those interviews as a service that they would really like to see added onto the program.
This is for Redbird. The death rate of restaurants is horrible. And mom-and-pop restaurants, non-chain, is even worse. Did you check the data on what the death rate is for restaurants in small communities like Utah?
Yes, so your question is, have I checked the rates of success for small restaurants in smaller cities? I have not, but I am confident in the recommendations that Redbird will be able to succeed and be able to use their community as a leverage to help them succeed in the Yukon market.
And you as a banker will know.
I don't have any bank experience, so I'm not really sure how to answer that question, but I have gathered different values to present to the banks. I have started on startup costs and then have the total available market to present to the banks to show them that Redbird can be profitable and successful.
For the Redbird, how do you figure out the growth rate for such a small business?
Yeah, so your question is how I figured out the 3% growth rate. That is just an industry standard that is online and from, I forgot what source, but it was an online industry standard.
We have time for one more question.
So I have a question for DRAB. So when you're developing a product for a third world country, how do you factor in corruption, which is a common problem, into your economics?
Could you elaborate on what specifically about corruption?
Well, many of the countries in Africa, so just in terms of finance, when the United States sends aid to those countries, most of it is immediately sent to a Swiss bank account. So corruption is a big problem. So when you do business, how does DREV take into those sorts of factors when they're looking at trying to take a product into a third world country?
Sure. So your question is, how does DREV going to control and make sure that their product reaches the end patient? DREV has actual full-time employees in the countries in which they benefit. And so because of these long existing ties with employees in East Africa and India, they've successfully in the past been able to deliver these medical technologies, and they have guaranteed that these solutions have actually reached poor patients in these healthcare facilities.